sincerely hope that we're able to do this in person for 2022. Each year during the Minority Mental Health Awareness Summit, No More Martyrs hosts what we call a community conversation. And this is really an action-oriented conversation where we come together, talk about a particular topic, and then kind of collectively decide how we might want to move forward or what kind of changes or actions or work we might want to do in this space for the next year. And our topic for today is deconstructing BIPOC. And for those who might not be familiar, the term BIPOC, which Shawndrika Cook will be typing into the, she's like, oh, really? She'll be typing into the chat box just momentarily, stands for Black, Indigenous, People of Color. There has really been a push now to using the term BIPOC instead of the term minority. And I can say as an organization, we've been hosting the Minority Mental Health Awareness Summit this is our 5th year. But after year 2, we did start receiving feedback and a little criticism about using the term minority. And even in the space of higher education, which is where I work, there is a shift away from using the term minority. And I can understand this because we're founded and headquartered in Birmingham, Alabama, even though we're a national organization. And when you think about the term minority, it means something different here in Birmingham, Alabama, than it does in Los Angeles, California, right? When you think about demographics, when you think about culture, when you think about ethnicity, the term minority shifts depending on where you are in the world. And it also has negative connotations. So I understand the desire and the interest to really think of a name that's more appropriate. However, there has been some criticism about the use of the word BIPOC, because years ago, there was a shift away from using the term people of color. So some of those who have been critical feel as though it's a shift back to using the word people of color. And then there are others who say, when you think about Black, Indigenous, people of color, who is not included? Is there a certain level of erasure in that term? So what I'd like to do is just jump into this conversation. I think it's going to be a good one. I think it's going to be a community-centered one. I hope that you engage in conversation in the chat box, because we love the lively conversation that's been taking place throughout our sessions already during the summit. And what I'd like to do now is ask each of our fantastic panelists to go ahead and introduce themselves. I'm looking, I don't know how the view looks from everybody's perspective, but I feel like we've got the Brady Bunch box kind of thing going on here. So I'm going to go with the first box that I'm seeing and ask Miss Corinn O'Brien to please introduce herself.
Hi, Dr. Richardson and fellow panelists. It's so great to be here today. My name is Corinn O'Brien. I'm the Policy and Advocacy Manager at the Birmingham Education Foundation here in Birmingham, Alabama. Dr. Richardson and I have met each other through some of the work that I'm doing with issue advocacy. We, in the past year, have worked to develop a broad coalition of community organizations and individuals working on student mental health here in schools. So that's how I'm here. I'm the Birmingham Education Foundation. I'm not a mental health professional, but we've been working intensely on this issue with student mental health, and we have formed the Birmingham Coalition for Student Mental Health, and that is how Dr. Richardson and I have met. I'm so glad to be here today, and thank you so much.
Thank you for joining us. And I'd really like Jennifer to introduce herself next. Again, Corinn is joining us from Birmingham, Alabama. Jennifer, I believe, is in Washington, D.C.
Hi, Nadia. Thank you for having me. My name is Jennifer Chang. I am the Director of Digital Marketing at Mental Health America. I am actually located in Atlanta, Georgia right now, but our main office is in Washington, D.C. Well, just outside of Washington, D.C. in Virginia, but close enough. But yeah, we've worked with No More Martyrs before in like other social media campaigns like Twitter chats. So I appreciate you inviting me for this panel.
Thank you. Thank you so much for being here. And I would encourage the panelists to type the websites for your organizations in the chat box so that those who are participating in this session can really connect to your organization. So if you want to put your websites or your social media handles, I invite you to do so that they can follow you. Dr. Nelson, I'd love for you to introduce yourself next.
Good morning. I'm Dr. Artie Nelson. I'm a child adolescent psychiatrist here in Birmingham. I do both private practice and consulting and just looking forward to the discussion.
I'm excited for Dr. Nelson to be joining us too. He comes with a lot of fantastic experience and has lived in various parts of the country, so he really understands the difference in dynamics in ethnicity and culture and how the term minority can be contextualized. And I think he also has a keen insight into the history of diversity in the field of mental health. Alec, hi, it's good to see you again.
Great to see you, Dr. Richardson. Miyuyam, na tong Alec Calac ha, non athach Pauma no Tanglish UC San Diego, unga Tanglish Pilachilanga Palachik. Good morning, everyone. Calling in from San Diego, bright and early at 7 a.m. I was in Washington, D.C. for the past 2 months, so still adjusting. I had the honor of meeting Dr. Richardson on a conversation about trauma-informed systems of care a few months ago with Miss Mia Keys, who I believe spoke on day one. Really excited for this conversation and to share my own perspective on BIPOC, which I think has some positive uses, but more often than not, some kind of misguided uses.
Absolutely. Thank you so much. And then last but certainly not least, I'll ask her to introduce herself again, our very own No More Martyrs team member, Ms. Shawndrika.
Good morning. Hey, I am Shawndrika Cook. I am a licensed mental health therapist here in the Birmingham area. And of course, I'm part of the clinical team here with No More Martyrs. And I'm excited to really have this conversation and to really dive in. We've been talking about it on the backside, so I'm ready to talk it in the front. So ready to engage. Thank you for having me.
Thank you. Thank you all for being a part of the panel in today's discussion. I know that we have all kind of worked in the space of diversity, ethnicity, culture, and we've all expressed a keen interest in health equity, culturally responsive care, and a pushback against any forms of health disparities. When it comes to terms and labels and categories, sometimes various forms of difference can get lost in the shuffle, especially when you think about intersecting identities and forms of representation. I wanted to start this session off with a quote that I know we're all familiar with from Audre Lorde. If I didn't define myself for myself, I would be crunched into other people's fantasies for me and eaten alive. I wanted to start with that term because when we think about deconstructing BIPOC, I personally am interested in the pros and the cons of this conversation and help us think through the value of naming ourselves for ourselves. So Shawndrika is very familiar with this. Again, with No More Martyrs, we've been receiving criticism for the use of the term minority. We've held on to it for a couple of reasons. First, we haven't come up with another term that would sufficiently take its place, because when you think about what we cover in this particular summit, it's not just race and ethnicity, it's identity, it's sexual orientation, it's culture, it's ability, it's all these intersecting forms of difference that we address. So it's not just race and ethnicity that we're addressing, but BIPOC as a term really just covers race and ethnicity. However, the term minority doesn't necessarily, has the negative connotation and doesn't necessarily cover all those terms as well. One of the shifts I've been making is away from using the term minority and using maybe historically marginalized, right? Because that's really what we're saying when we're using these terms often in the space of healthcare, health equity, mental health advocacy. But what I've been seeing is a shift even in business, in education, in health towards the use of the term BIPOC. Another reason why we've held on to Minority Mental Health Awareness Summit is because the US Senate recognizes July as Minority Mental Health Awareness Month. And specifically, it's B.B. Moore Campbell Minority Mental Health Awareness Month. And B.B. Moore was a Black woman. She was an author, an educator, and a mental health advocate. She was the co-founder of the National Alliance on Mental Illness Urban Los Angeles chapter. And she used her voice and her writing to really advocate for this space. And so when she passed in 2006, some of her closest friends and colleagues advocated for the creation of the B.B. Moore Campbell Minority Mental Health Awareness Summit. And that was passed by the US Senate in 2008. So by shifting away from minority mental health awareness, some have argued that there's a certain level of erasure by no longer associating it with the work and the legacy of B.B. Moore Campbell, which is really truly how it came about. So I wanted to start off with that and just say this is kind of the dynamics of the conversation. I think what I'd like to do is start with Dr. Nelson. You've worked in California, you've worked in Alabama, you've worked in various parts of the country. So when I'm talking about contextualizing this understanding and idea of difference and diversity and culture and the use of terms like minority, you've seen it change and shift and move in the field of mental health from various angles. And so I'd like your perspective on the value of labels and who may be included or not included in the term BIPOC.
Yeah, thanks for, again, having me. The biggest thing I've seen across the country is the change in dynamics. If you look at Los Angeles, for instance, when I was living there, it was okay to kind of refer to as being a minority at that time. Now, this was the 80s and early 90s. The shift started to happen when the so-called minority group was growing to the point where they were no longer the minority, but actually the majority. And so it was interesting dynamic. A lot of the people at the hospital that I worked at were starting to call it the majority minority. And my chairman said, well, this is starting to get really kind of tricky. Why would you call a majority the minority? So we started looking at that word, that term. And if you look at just sort of the Webster dictionary, it is a minor, a less than, a group that you can see as put in a certain category. So I think we have to get away from that label of minority because of the, as you said earlier, the negative connotation. Now, obviously, moving to the South, people would refer to themselves, people of different cultures, as a minority. So the word was still around. It was an interesting shift for me because I had to sort of readjust my language moving here, working with patients. I say all that to say, consciously, I think we need to just look at these terms and what they're meaning and what their political and power meanings are, because I think when you think of people as being minor, you've already put yourself in a less than position. And I see that. I work with a lot of kids. I work with kids as young as 2 and 3 years old, and you'd be surprised how easy it is to pick up on these terms. The other part I would like to throw out is, you know, we're 95% subconscious or unconscious of what we do. The latest, some people even argue maybe we might be as high as 10% conscious. In other words, a lot of things that we do, we just automatically will do. I always use that example. You go to work in the morning and you don't count how many red lights you stopped at or, you know, which street you turn, you just automatically do it. That's the subconscious mind just getting you there on time, hopefully, and getting to work. That same dynamic works in terms of words, interactions with people. We are on an automatic pilot almost. And I think we got to really look at when you change a word and when you use a word and the evolving of this word, I think we're looking at trying to change that subconscious so that you will think of yourself as more powerful, able to do things. And that's what I try to share with my kids that I see in therapy, that, you know, you're not minor, you're not less than, you're powerful, that sort of thing. So the word is, you know, words are very powerful. There's a book called The Power of Words that talks about that words are, we think words are just kind of simple, but they really are very powerful. So I'd like to start off with that it's, you know, a conscious meaning behind it and a subconscious meaning behind it. And we have to make that shift.
Absolutely. Thank you. Jennifer, Mental Health America has really made this shift in relabeling Minority Mental Health Awareness, BIPOC Mental Health Awareness Month. What is some of the motivations and some of the work that has gone into initiating that shift?
So I guess I can give like some behind the scenes story about why we made that shift. And we're not like trying to relabel anything or erase B.B. Moore Campbell's name or legacy. There's actually a resolution going on right now in Congress to rename National Minority Mental Health Awareness Month to BIPOC Mental Health Awareness Month, but we pushed for the inclusion of Phoebe Moore Campbell's name to be included in there. So so we're not like trying to erase anything, but we work with person first language as an organization and as like a community-based advocacy organization. And a lot of our audience is between the ages of 18 and 35. So last year, when a lot of the civil arrests surrounding the deaths of Breonna Taylor and George Floyd and Ahmaud Arbery started coming about, we started to see a shift in the way that our audience talked and the way they talked to us. And so we went around to different partner organizations and different advocacy organizations in the space to ask what they thought about what was going on and how we should approach July, because it was coming up really fast. And they had the same things to say that Artie had mentioned before when he was saying that minority puts like the majority, which is like, what does that mean exactly? Like the majority gives power to like white supremacy. It gives power to like what is expected to be the majority, like cis, non-disabled, or able-bodied people, straight people, white people. And we didn't think that that was the way we wanted to talk about these issues. And so the more we talk to other experts and other leaders like the Human Rights Campaign or the Steve Fund or the National Council for Behavioral Health, we settled on the term Black, Indigenous people of color because it was kind of what we were seeing at the time. And it also centered a lot of our work. So we were calling out issues specifically, like when we talk about police brutality and we talk about the diagnosis, we talk about like schizophrenia, or like when people are in crisis, they get taken to jails and prisons instead of the hospital or instead of getting care. And this disproportionately affects Black Americans, particularly Black men. And by being specific about these issues and uplifting these issues, we can really highlight that. And when you uplift the most marginalized or like the most underrepresented in these communities, you uplift the whole. So like when you make things more accessible, for example, for people who are deaf, if you add captions to things, it doesn't just help people who are deaf, it also helps people who just have audio processing issues, and maybe people who just have a hard time like following what's going on in the story. So like when you uplift people who have been historically marginalized, then the greatest good can happen. So we wanted to use a term that would help to center those issues, if that makes sense.
Absolutely, that makes a lot of sense. Alec, I know that we've kind of talked about this briefly in regards to the use of the term BIPOC. When you hear that term, what are the first thoughts that come to your mind?
You know, I think when I hear BIPOC or I read it in a medical article, I immediately hit Control F and type in Indigenous or Native or Indian and see if there's actually any fair and accurate or true inclusion of Indigenous people. And, I think going back to what we said earlier for kind of what's the right term, I mean, I could just count down on like two hands and my feet and say, well, what goes into a term? How does it define? Who uses it? We have minority, underserved, minoritized, historically excluded. The one that I actually like, which comes from Abigail Echohawk, the CEO for the Urban Indian Health Institute, is colonially underserved. Because when we think about a term like Indigenous, it is so relational to a specific location, and Native people are very relational to our own communities and our homelands, where the United States, among many other parties throughout the centuries, have forcibly removed us from those locations. And it's been on us to maintain our cultural practices and our traditions. And I read an article a few years ago that talked about how the invisibility of Native people in our society is just a modern form of racism against us. And it really obscures the harsh realities that we live in today and the underinvestment in infrastructure, healthcare that keeps our health status lower than most Americans. And, I think the first time I saw BIPOC was on Twitter, and I was like, interesting, like this is a cool term. But then over time, I started to see that it was a lot of people using BIPOC without actually referencing anything about Indigenous communities. More often than not, it was like a lowercase I that had like an asterisk, and it was like Indigenous referred to, but not represented. And I think the people who use it have, for the most part, the best of intentions, but they don't think that, just by using it, it kind of seems like it's almost like a checkbox, like, oh, we used it, we're being inclusive. But, when you use Indigenous, and you kind of start out with like a big circle, like you have Indigenous, and then you have Native American, and then you have American Indian, Alaskan Native, and then you get into specific tribes in the United States that may be federally recognized or state recognized. And in the US alone, there are 574 federally recognized tribes. So if you know the problems or the disparities or the history of one tribe in this country, you only know that for one tribe. There are hundreds more. In my own state of California, there are close to 200 different tribes. Only half of them are recognized. And in my county alone, there are 18, the highest of any county in the country. So I really think we have to be intentional and understand what happens when we use a term not in a good way, because I've seen people of color, I've seen BIPOC, I've seen IBPOC, where people try and reorder to put Indigenous first. It doesn't help. I've even seen BIPOC, where Latinx is pulled out and also specifically mentioned. And for me as a trainee, I think about the impact that this has on Native youth and mascots, for example, when we think of things like the Washington football team. But that could be a whole nother panel conversation.
You've said so much in that statement alone. I think, outside of, No More Martyrs, I do DEI work, right? So one of the things we talk about are categories and the importance, right? Or the necessity to have categories. Like when you think about how our minds work and you think about how we operate in the world, even specifically, Alec, I've worked in medicine. When you think about the need to be able to learn and recall information quickly, categories are very necessary. It's a part of what we need to do in life. However, when it comes to these types of terms, and I do agree with what you're saying, is that individuals who are using them have the best, I think for the most part, have the best intention. But when you use these terms, it's a very easy way to capture and participate in a conversation that's way too dynamic to put into one term. One of the things that's come up a couple times in some of the sessions this week has been, I am not a monolith. There's no Black experience. There's no Indigenous. It's so dynamic. It's so layered. It's so complicated. When you think about even the dynamics of the Black experience and the layers of experience there, I'm a first generation American Black woman in Birmingham, Alabama. What does it mean to be a Black woman in the state of Alabama? What does it mean to be a first generation Black woman in the United States? What does it mean for my ethnicity and my culture? What does it mean when you incorporate the fact that I'm a cisgender heterosexual woman and all my other forms of identity? What does that mean? And is that the same as another Black woman? We might have commonalities, but there's so much more to what the experiences what experiences we have. So everything that you're saying makes complete and absolute sense. It's like when we group everything together, then how can we sincerely focus on the issues that one particular group is having and then put intentional allyship into that space? It's complicated because I do think that there is value in us working together because there are shared commonalities in oppression, there's shared commonalities in marginalization, and there's shared opportunities for using a social justice framework to address those those things and break down systemic inequality and the damage that it's doing, systemic racism, systemic sexism, systemic homophobia. So we can work together on that behalf, but our ability to work together in that behalf also means, if we're going to do it in a very culturally responsive way, that I sincerely need to understand your specific experience. And you need to sincerely understand my specific experience. I would like to shout out the Black Emotional and Mental Health Collective, because in the same space that Mental Health America is doing this work and having conversations with Congress, they are actually doing some work to bring about a misogynoir and mental health awareness month. And if you're not familiar with the term misogynoir, it's really misogyny, but racialized misogyny. So this would really be a mental health awareness month that focuses on the experiences of Black women and how they have to manage racism and sexism, how those things impact their mental well-being. So I'm going to put their website in the chat box, because I'd really like you to follow their work. We're looking to collaborate with them in that effort. And I'd also invite you to log into No More Martyrs website, because we're actually in the process of writing a book titled Misogynoir and Mental Health. So that's going to address those very things. It's a perfect kind of collaboration to work with the Black Emotional and Mental Health Collective. And the term misogynoir, and I'll put this in the chat as well, was coined by Dr. Moya Bailey, who is a professor. So I'd love to share all of those resources with you. Corinn, I'd really love for you to talk about the mental health work that you're doing in the school systems in Birmingham and some of the experiences that you're having with students, maybe that you have the opportunity to create these programs for, and the needs, the mental health needs that you're hearing from the educational administrators and students in that space.
Sure, absolutely. And Alec, you got me thinking now. I'm thinking a little bit about what adjustment we need to make in some of the language that we have in our mission statement. But yes, Dr. Richardson. So we, started in March of 2020, deciding what advocacy campaign do we want to stand up, and then all of the concurrent crises that our nation has faced all kind of unfurled. Right? The global pandemic, the economic crisis, our nation's reckoning with racism and white supremacy. And throughout that, we realized, like, okay, all the community engagement that our organization is doing is identifying that one of the main concerns of students and families and educators is student mental health, even before the pandemic began. And now, this has even tripled, right? And all of these crises are disproportionately burdening. And I want to use the term that you suggested earlier, Dr. Richardson, because I feel like of all these terms, this feels like it fits right to me, is historically marginalized groups. And how a lot of the students in Birmingham City schools are from that group. They're historically marginalized. There's 96% of the students in Birmingham City identify as Black. There are 65% of families are from low income and qualify for free and reduced lunch. And so we wanted to really be thoughtful about, our students and families and educators are identifying this as a concern. We know that, nationally, if this is a deeply and widely felt problem, we got to figure out how to actually not just write about and research these issues, but how to actually advocate. And we wanted to make sure that we were centering our community in the way that we did that. So we convened this incredible group of now what has become 27 organizations that are part of this coalition. Dr. Richardson is one of those incredible coalition partners. And from the beginning, we brought this group together. And the first thing we did was community engagement. We needed to understand, we all knew that this was a concern, but we didn't know enough about this incredibly complicated issue of student mental health. And so from October 2020 to December 2020, the first thing we did was community engagement. We launched a huge survey. We also realized you can't get all the information you need from a survey. So we did community conversations throughout, held by our community, our coalition partners, and basically identified the challenges that we were hearing from students and families and educators, and also the solutions that they wanted in their schools. And so that has, we've turned that into a community-driven set of policy recommendations and a policy playbook. And, we've been really intentional about the language we use. And I think that is something that's really important in policy and advocacy, especially in the work that we've done and bringing a racial equity lens to that. Language matters. And making sure that we use language, especially because what we really care about at Ed is we want to make sure if we're writing something that it's accessible and that we're not alienating people by language that we use or jargon that we use. And I think that has been something that has been kind of a debate and a point of tension in the coalition. We knew that from the beginning, we wanted to center communities that were historically marginalized. And we wanted to figure out how to say that best. Now, what we have now in our mission statement, and I'll read it right now, it's the Birmingham Coalition for Student Mental Health is coming together to develop and pursue equitable, community-driven policy proposals to address student mental health disparities in Birmingham, Alabama. And the second sentence says, we are intentionally centering Black, Indigenous, people of color, and then in parentheses, we put BIPOC as we work towards this mission. And this was kind of a point of contention because some coalition members really wanted this language here, but others, to kind of mention what Dr. Nelson said earlier, older community members weren't familiar with this term. And they're like, people aren't gonna know what you're saying when you're using BIPOC, so are we potentially alienating people by using something that might feel like a more academic term? And so that's kind of what we decided to go with it. So that's still something that's a part of our mission statement. But as this conversation is kind of unfurling, what I'm realizing is we might need to revisit that language, and that's something, a discussion our steering committee might need to have. But I've really enjoyed this conversation so far, so.
Thank you, Corinn. What I really appreciate about your about the group's approach to this is that you really put a lot of responsibility. I don't want to say responsibility, but you highlighted the voices of young people. You didn't come into the door and say, hey, this is how I think we should go about it. You really created this platform for you to say, hey, what do you think this should look like? And you tell us what you want it to be. You tell us what you think it needs. You did that with students, you did that with parents, you're doing it with coalition members. So it wasn't this idea of I'm going to come in and this is what we know from academia. We're going to come in and we're going to create the platform and the environment for you to name your own issues and also name your own solutions. And then we're going to support what you're saying to us. So I really appreciate the work that you're doing. And I actually really appreciate the fact that the word intentional is in the mission, because I think intentional is exactly what I see in the work that's being done. Sure. So Shawndrika, I'm coming for you. You're next. So Shawndrika, let's talk. We have had some interesting conversations. I feel like there have been some times where I'm like having to talk you down. I'm like, hun, sis, come back. But I understand it, right? I get it. And I want you to speak to how new terms, new concepts, new ideas can trigger members of historically marginalized populations, because it feels as though this is another attempt to name and frame you, and you have had no say in it. So this is the conversations that you and I have had. And when I think about it, I think about racial fatigue syndrome, right? I know one of the things that Jennifer mentioned was like at the height of the Black Lives Movement or Breonna Taylor or George Floyd and all of these things that were happening and have been happening over the course of several years now. There's a certain level of racial fatigue syndrome, right? That's just, we're tired, we're worn out, and we're exhausted, but there's also still work to do. So at the same time as you're tired, you're still trying to be actively engaged in bringing about change and doing advocacy and community organizing. And when we started talking about this term, because I first presented it to the team like, maybe we should think about renaming the conference BIPOC. And then the feedback I got, I was like, oh, maybe not. Like, maybe not. And then when I really started to think about the kind of conversations we have in the summit, it's not just race that we talk about. It's identity and it's difference and it's ability and it's classism and it's all these different types of forms of identity and systems. So it didn't really capture what we were doing. And then I had other conversations with other licensed mental health professionals, and it was a split. It was a lot of pros and cons. But what I'd like you to speak to as my teammate, colleague, and friend is, why is this triggering for certain individuals? Why is this term just triggering in a sense of, wait, that's not who we are, but at the same time, the term minority is still not as applicable? Why do you think that happens?
So yeah, I'll give y'all the insight. When we had this conversation, I immediately become traumatized. This term can be traumatizing. And I say that because I was like, hey, y'all, I just need to know, do we have you're categorizing us, but do we have any positive history together? And when I started looking for positive history with Black and Indigenous people, Black and Hispanic people, Black and, because I can identify as Black. Before I identify by any race, sex, or sexual orientation, you see me as Black first, right? You see me as a person of color, however we want to say it, but you see my Black first. And so before I get into all the other entities of what it can look like, let me identify what you see first, and that's being Black. And I look to see if there was anything positive historically that we have in commonality with what they were grouping us in, and there was nothing positive. So now I became immediately triggered by this, because wait, so first of all, we just fought for just a space, and now you're categorizing us with people who we have traumatic experiences with. And so I felt like that term was one, a safe space for, and I hope this is a safe space for white people. I felt like, okay, we can give them a term and make them feel inclusive and give them a kumbaya moment. Maybe we won't be so ugly in our history, in American history, in how we address people who don't look like us. And so that term became more and more traumatizing the more in depth I looked at it, the more I looked at how it was seen and the categorization it was bringing. It felt like you're just taking us and saying, hey, we want to make y'all a kumbaya, so we're going to put this title on you and y'all are forced to become a village. But we have no history together that's positive. We have no history together that says that we can be of that. Alec just said, you know, when it comes to Indigenous people, there's a whole nother level of breakdown that comes into place. And so, and even though there are some commonalities, right? Because there's some Black Indigenous people, there's some Black Latinx people, there's some Black Asian people. There are Black people that are still in these spaces. And even though they are, the history behind all of that is so traumatic. There's no positive history even with them being in their spaces. There's no positive of Black Latinx people. We can see that with the Heights. There was a conversation about how Black Afro-Latinx people were not well represented even in that movie. And that movie was actually formulated around the Latinx community. But there was even controversy in that, like, where are the Afro-Latinx people? Where are the Caribbean people? Where are these people that can fit in that same category? So again, this term continues to become traumatizing because it feels like you're stripping us of all of our legacy, all of our history, all of our work, and saying, hey, we know you got trauma, so we're gonna put all y'all together, bam, and y'all kumbaya. And so it's like, wait, but no, like yeah, we have commonalities, but you can't just strip us of our history. You can't strip us of tradition, put us together as a village and say, hey, now kumbaya. And so that's where my trauma comes in with that.
So I think you said a lot. I think that it's really interesting. It makes me think about the conversation around critical race theory and the politicalization of that term, because what you're saying is BIPOC is an easy term for those who don't want to do the work to really strip down and get to the difficult and complicated history of these individual groups. And that's true, right? Like, or I don't want to say that's true. That idea is true because it's if you take one term and you're not being held accountable to really deconstruct and contextualize, that's the name of this panel, right? Deconstructing BIPOC. If you don't do the work to deconstruct and really contextualize that term, then you are going to miss out on the unique histories of various groups. And I think that it reminds me of critical race theory because in essence, that's what that theory has the ability to do. It's an opportunity to take that concept and really say, hey, racism is built into our systems in various ways. Sexism, homophobia, all these various forms of difference are built into our systems in various ways. So how can we address them? How can we understand and identify the complicated histories of various groups? So I think that makes a lot of sense. So then my question now to the whole group, and anyone can jump into this, is, does BIPOC do a disservice, or is it an opportunity for growth when we have the conversation about decolonizing mental health? When we think about mental health being understood very much in still a very medical model, but attempting to make that shift into an intentional biopsychosocial model, but still really historically and presently framed in a medical model, does the term BIPOC do a disservice to decolonizing mental health, or is it an opportunity for us to really dive in and have different conversations? So anyone can jump into that question.
I'm gonna go first.
Go ahead.
I really feel like it's a colonization. It's a comfort zone. I don't see how it can grow, because when you do it, you will use, when you create a term and you create associate terms with that term, you categorize people only in those terms. So let's go back to what Alec shared. Alec shared about the indigenous people. So though we have commonalities, we have more differences. How indigenous people actually do healthcare. But if you're saying, okay, if they're in this category, if they're BIPOC, this is the structure of how we handle our BIPOC patients. And it allows us to be in a place of straight generalization and comfort. I really feel like this is a comfort term. I really feel like this term says to us, those of us who are included, that you are included. We see you, but you don't see us. You didn't do the history of us. You didn't ask us. And even though it seems like it feels good, it feels warm and fuzzy to hear it, like, man, we finally came up with a term, and it doesn't feel degrading to those who we're referring this term to. It's like creating a whole nother system. Only this system makes it feel warm and fuzzy versus being called a minority. It's still generalization to me. So I don't see how it can grow in a way that is deconstructing systems. I just feel like it's just creating new systems with a shade of, we love you, we gave you a category, here we go. So that's just.
Oh, no, please, Dr. Nelson, you go first.
Well, again, I'm referring back to Alec, because I think you brought up something very important. There is a psychologist in San Francisco, Dr. Wade Nobles, that mentions power is the ability to define reality and have other people accept your definition as if it was their own. And I think that's part of what we're talking about. I think you can let that BIPOC term define you, but you can also use it to find out about different cultures and see what we do have in common. So it doesn't necessarily discount anyone's culture. Number two, and Nadia knows I'm a history kind of person, and I also like to tell stories, so I'll try to keep it short. But I had an experience probably about, I want to say 15 years ago, with a Native Indigenous adolescent at a residential treatment center who no one could talk to, and I'm not bragging on myself, but I was able to connect with her, I think partly because I was a person of color. And her beef was always about, I want to go back to the res. I want to go back to the res. First, I had to be educated what she meant by the res. And she appreciated that, because she was saying, wow, you really are taking an interest in what, and I said, wait, explain it to me. What do you do? That kind of stuff. But she still was identifying herself, and this was the struggle, as being white. And it's funny how things just sort of come into place. You can call it spiritual. I had a case yesterday, and it's a lady that is very active in the Alabama Native Indigenous organizations here. And she used the term that she is white. And I think, again, power is that ability to define reality and then accept that definition. And she later kind of, pushed back a little bit on that. And she said, well, I'm definitely Native, but in the sense of power, I define myself as white. So these are uncomfortable conversations. These are things that I think, it's not enough time in an hour or a whole day to talk about this, but I think it's one of those things that we really have to talk about. But I don't think one term can discount the culture of Native, Indigenous, African Americans. The term minority apparently was started in 1919, referring to Eastern European folks. And I've talked to Italians who said they were called minorities, and that was a negative term for them. And then when they got to this country, they took on the term of being white. So we have to look at, again, who's behind this sort of defining and definitions so that we can move beyond this. And it's not just about, calling it minority mental health or African-American mental health. It's still helping people and trying to get through this. It's a very, very difficult conversation. So I just wanted to throw that out there.
Oh, it's hard to follow you two. I think going back, I think when we start a conversation and use BIPOC, I think we've, just by invoking the term, we've already narrowed the conversation, and that's the space that we're going to be stuck in. And it's so hard to get out of that, because I think about where I am as a fourth year MD PhD student at UC San Diego, where I'm at the institution that is built on some of my own land, yet I figured out as a second year medical student that I am the first person from a California tribe to ever attend UC San Diego School of Medicine. And when we think about like diversity in medical education and what are the right terms to use, we often forget about the very communities where our institutions are located and what responsibility we have to those people. So when I think about BIPOC, or again, just what terms we're using, the reason why I linked that article from Mental Health America is I reference that a lot because, this is an example of us capturing data about mental health for the Native community. And when you have the numbers, you can really appreciate the magnitude of the crisis, where you can fill every Major League Baseball stadium on the East Coast twice with the number of Native people who have reported a mental illness in the past year, and I believe it's from 2020. But on the flip side of this very informative infographic, and this is not a dig at Mental Health America, I'm sorry, Jennifer, is in the figure in the text, you're going from a title of Native and Indigenous communities and mental health, and then saying Native American, Alaskan Native, and we're seemingly swapping between all of these terms that we don't necessarily collect on surveys or data, or that's how our systems are structured. And when you are kind of using them so interchangeably, you miss the subtle differences between each one, and kind of who you're being inclusive of, but also who you're being exclusive of, where it reminds me of when I was reading a article about BIPOC communities, structural racism, and obesity. And like I said at the very beginning, I used Control F, and I found BIPOC used 28 times independent of the references. And it only talked about Black and Latinx disparities, and nothing about Indigenous obesity, diabetes rates, which are much higher than the general population. And about like 2 or 3 weeks later, an author from that article commented on a Native physician's article about structural racism in the Indigenous community and said, this is a great article, but you don't talk about why structural racism exists in Indigenous communities. Like, you need to explain that. And it's like you're telling the Indigenous person to explain basically just the country. Because I'm sure we all saw the remarks from Rick Santorum on CNN, where he said there's nothing Native American about American history, but you look at the names of our states, our cities, and all these references to our peoples, and it's so difficult to see people, again, speak about us without us. Even Fox News this past week, or maybe like the week before, where we were talking about like critical race theory, quote unquote, land acknowledgements, but then pundits saying, well, we won the battle. Like, why do we care? Fair and square, we got the land. They need to stop being angry. It's like, well, no, it doesn't work like that. So, I think having that, again, racial equity lens and applying critical race theory to just understand why things are the way that they are today is so important, not just in the medical profession or in the mental health space, but all sectors, because it helps you understand how you can be an active ally, co-conspirator, or just feel like you can address something in your own role, as opposed to continuing to just not be inclusive of the communities that you're talking about.
So just to take a little bit of everything that's been said, what it sounds like is maybe BIPOC has the unfortunate possibility of being just easy. It's an easy term. It's a simple fix. But all the work that you're talking about doing is hard. It's hard work. It takes much more time, and we work in a very fast-paced, get it done now world. It takes more time to dig into someone's history. It takes more time to understand someone's culture. I do appreciate about Mental Health America these graphics, because the graphic that you shared, Alex, there's another graphic that's similar that captures Black mental health statistics. And I've used that graphic in presentations, so it's very helpful, kind of a quick snapshot. But then along the same lines of what you mentioned, when you take the term Black, and I've had this conversation, I remember writing a paper about this in undergrad, right? And that was many years ago. But I remember having this conversation some time ago where Black is great. It's a catch-all, right? I'm proud to be Black, but my family's Jamaica, Cuba, Guyana, India, Africa. So what does that mean? What does it mean to say Black when there's all these different cultures, and each culture has its own history? And even within those cultures, there's difference in dynamics and oppression, right? And powers of it, or systems of inequity. So while we're talking about Black, and we say maybe Black American, it's going to take so much more work to flesh that out. And when we think about advocacy and having to produce quick numbers, maybe for the purposes of advocacy and quick statistics to engage our elected officials, that also gives rise to opportunities of erasure as well. So it's complicated. It's going to require so much more work to be intentional about these conversations. So in that sense, there's challenges with the term BIPOC, but there's also opportunities with the term BIPOC. I think if you're trying to do quick snapshot conversations with elected officials, it could be helpful. However, when you're talking about the long-term advocacy and systemic changes that need to be made, that the term alone is not going to do it. You really need to flesh out the histories and understand the dynamics of each individual culture. So we have about 5 minutes left in the presentation. I agree with Dr. Nelson. We could have sat here and talked about this for probably 3 hours. We could have sat here and talked about this for a while, because it's a complicated, dynamic, but important conversation. And I appreciate that we selected it as our community conversation. I really wanted this to be a space where we could learn from each other and really think about these things as we're moving forward in the work that we're doing. So I'd like to ask maybe each of you to share a closing thought as we wrap up today. Should I call names?
Sorry, I mean, I think this has been a very thoughtful conversation. I feel like the things that I have learned today as a white cisgendered person who I've learned a ton in this conversation. And so I just want to thank you all for that. And I also want to realize that I think our coalition, our steering committee has a little bit of work to do around this term BIPOC and figuring out, is this the right term we need to be using in our mission statement? And if not, what is something that we feel is going to be appropriate in the work that we want to do. And so I really appreciate specifically Shawndrika. I feel like I learned so much from the perspective that you shared. And also Alec, I'm realizing we've used the term BIPOC, but have not included Indigenous youth families in our conversation. So are we really being truthful to that term? And I guess we're not. And so we need to really revisit that. So thank you so much. I've learned a lot today.
And I think in closing for me, I'd also just emphasize that Indian country is not a monolith. We represent such a diverse multitude of opinions and experiences. Not every Indian grows up on a reservation. Only 20% of our population does. Otherwise, 80% are in urban centers because of federal policies like relocation in the 50s. So what I would encourage and challenge everyone to do is broaden your perspective. Look at the news sites and the media that you're absorbing on your phones, on your computers, on your emails. Subscribe to Indigenous-led media like Indian Country Today, and understand what it's like to have these stories told from our own perspectives, as opposed to things like CNN, New York Times, Fox, Huffington Post, because it's markedly different when you shift who's in charge of the narrative. So thank you so much for this conversation. And it's been so nice to connect with all of you, especially where I am, where I often feel like I don't have much to contribute because of where I am in my own training.
Thank you.
Yeah, I'd like to, I guess, piggyback that. I really appreciate the conversation. I think it's something that we certainly need to continue. Like I said, we could do this for 2 days. I'm always a student. I always tell the story again about the hero's journey. I think we're all on a hero's journey, and you'll have different conversations, ups and downs, but the end of the day, you want to try to learn as much as you can and always have that curiosity. I think what's a blessing to me is working with kids. I always see that kind of curiosity of wanting to learn things and do things. And I started out as a pediatrician and now child psychiatry. So I've been able to see that, but I learn a lot from my patients, a lot from people, and just sort of keep that part of it. And I think say it out loud, just don't use the term BIPOC, but go ahead and say what it says. I think it's a little different, because then it forces people to realize what you're talking about. Because these terms, the term woke has become just sort of this term that means different things to different people. When I was in Los Angeles, it was conscious. If you were conscious, we didn't even use the word woke. If you knew what was happening, you knew your history, you knew your Latin history, you knew your Native Indigenous history. But now it's become this sort of term. So we got to be careful of that too. Say what it means, I think, would be what I would leave you with. But thanks, it's been an excellent conversation.
For me, again, it's definitely been answer piggyback on what everybody said. Excellent conversation. I think it also makes us examine who we are as people that are non-white, what this really looks like first for us, and how we can grow from each other. Because in the end, I think the village mentality needs to take in place, because I think we have to be in a place that we understand that everything has to be inclusive. But in order to be inclusive, we have to grow from each other, and we have to exchange information and see what those commonalities are and how those commonalities bring us together. If this is a space for us to grow, let's grow in knowledge and wealth of each other. If they're going to put us in a box, let's outgrow the box. So that's my 22 cents.
And Jennifer?
Yeah, thank you so much. I think this has been a really interesting conversation. I think that what Alex said is really true. Is like we do need to be very specific and in like the work that we do moving forward, and that obviously infographics and like bullet points and statistics are not always going to be the most accurate way we capture those systems. But I guess the only thing that I really wanted to kind of leave off with is I like the idea of like bringing people together. I know that historically, not all non-white communities have been kind to each other. I can only speak to my experience as an Asian American, where even the term Asian American didn't exist until 1968. Because historically, even within our own communities, like we fought with each other. Chinese, Filipino, and Korean Americans have been colonized by Japanese, like in World War II and beyond. And obviously, like the Black and Asian communities have had like horrific crimes against each other. And I just wanted to say that I do like that there are ways that we can bring each other together because we do have common experiences. And I feel like dividing things like puts us against each other. I don't know. I'm not making a lot of sense. I'm sorry I'm not as eloquent as everybody else on the call here. I'm so sorry. And I'm taking so much time. But I just wanted to say that I think the term BIPOC and like centering Black and Indigenous experiences has also helped with a lot of the rampant colorism in a lot of our communities. I'm Chinese and Puerto Rican, so like within the Latinx and within the Asian communities, we have a lot of colorism. And by centering Black and Indigenous people in our communities, we've been able to address those issues within our own communities. And I know Asian American advocacy and civil rights groups have been pushing to address the anti-Blackness in our communities and focus on the issues that have been dividing us historically instead of blaming each other for our hurt and trying to heal. So I just wanted to leave it with that I do think that there are opportunities to grow. Language is so flexible and so ever-changing. Even the term, like what Dr. Nelson said, woke, even the term woke has become like outdated for a lot of people. It's like used in parody a lot of times. So I like that language is changing, and I like that I don't know, I like that things are changing and we're talking about these things. We're talking about them in the open. So yeah, sorry for all that.
Well, I just want to thank each and every one of you for making time to be a part of this conversation. I celebrate each and every one of you for the work that you're doing. You're dynamic. I have met everyone except for Jennifer and Alec in person, and I fan out to the work that you're doing. I appreciate it. I encourage everyone to follow our panelists on LinkedIn and on the various websites that they've placed in the chat box. I will continue to follow the work that they do because they are doing work that will change communities. And I encourage everyone who is participating in the summit, who's been able to view this conversation, to really think about having these kind of dynamic, difficult, complicated, layered conversations within your own circles as you do the work that you're doing in mental health. So thank you all so much. Again, if you were getting CEs for this session, please make sure your name was placed in the chat box. This session, as with all of our sessions for the summit, will be recorded and placed on YouTube, so you will have an opportunity to see it.